Hey guys, I want to talk to you today about how to address pain that might be coming from your obturator internus, which is a muscle on the inside of the pelvis that helps to rotate the hip joint. Uh, I see this pain in a lot of my patients and clients. You might have heard about the obturator internus before. Most people have not. Most people know a lot about the piriformis, which gets a lot of press, but the obturator internus, or OI, just doesn't have the same PR guy, but it still causes quite a few issues. So let's get started about what this muscle is, what it does, and how pain in this muscle might present. So I've got my handy dandy pelvic model here. This is the front of the pelvis. This is the back of the pelvis with the SI joint right here. So when we go to the deepest part of the pelvis in terms of the pelvic floor muscles, we go inside and right up against this front wall space. I'm going to zoom in here a little bit. That's the obturator internus. So it's pretty darn deep and high up there. It covers this hole right here called the obturator foramen on the inside. We also have an obturator externus here. And it goes from the inside of the pelvis here to looping around the ischial tuberosity. So looking at the base here, these are our ischial tuberosity bones. Those are our sit bones. So it loops out around the sit bone here and hooks in at the femur over here, so at our hip joint here. Pelvic floor things are really hard to conceptualize. 3D models help a little bit, but now you're looking at it in a 2D version. So if you have a pelvis at your physical therapy clinic that you go to, or you find a good 3D model that you can turn around in on the internet, that could be helpful also. But the most important thing you know is that it is deep in the pelvis, and then it comes to outside the pelvis and helps to rotate the hip. So it helps to rotate the hip outward, meaning it turns it out. So it's like your toes are turning out. This works in the same muscle group as the piriformis, as well as a few other external rotators. These muscles help us to twist and turn in space. They also have a tendency to overgrip or be overutilized when we have some postural deficits. So maybe when we're standing in an anterior pelvic tilt and kind of dumping forward, like you're dumping your belly forward. That changes the angle of those muscles, and they might be overactivated to try to provide extra lateral stability to the pelvis, like while we're standing and walking. They also tend to overgrip when we have a lot of glute weakness. So if our big butt muscles aren't as strong or as active as we would like them to be, which is a lot of us, right? If those muscles aren't activating, those hip external rotators will start to grip in to try to provide that good pelvic stability. And if those muscles get tight and overactive or spasmodic, then they can cause pain. So with the obturator internus, or OI, when that muscle gets spasmodic or painful, we can feel that in a few different places. A lot of times we'll start to feel in that front hip crease area, kind of that part that bends when you sit. That part can feel really painful. It can feel painful in the back glute area where people say, I don't know, it's back here, but I can't quite put my finger on it. That's usually the telltale sign for me that it might be the OI. Last summer, I had a spasm in this muscle and I felt it in the pubic symphysis. That was unusual, and I don't hear that one a whole lot. But once I released that muscle, pubic symphysis felt better. So a few different referral patterns that we can have when that muscle is overactive and won't quite let go to move through that whole range of motion. Now, because of this muscle's depth in the pelvis, it can be tricky to get to. As a pelvic floor therapist, my preferred method is obviously doing an internal release. So going in through a vaginal or rectal canal and pushing on that muscle and getting it to release. That's tricky if you don't have a pelvic floor therapist handy. Pelvic wands can be very, very beneficial here, but that is a whole other video in and of itself of how to do an internal release. I want to show you how to do external releases today, where you can essentially keep your pants on, address this muscle, and get it to calm down a little bit. these can still be very, very effective strategies. Admittedly, maybe not as effective as an internal release, but heck, I do them myself and they work fine 90% of the time. So the first way I want to show you how to do that external release is ideally with a buddy. So if you have a partner who is motivated to help and is willing to donate a hand, that can be really, really beneficial. And this is how I sometimes do an external release on patients or clients in the clinic or in home visits. So essentially what happens is you are laying on your side, okay? So that obturator internus muscle is this muscle right here that's coming out. So if you have a friend and you are laying on your side, your friend does a very flat hand. They find that butt bone of the downside glute area, right? They're going to slide in past the glutes, kind of just right in at that sit bone, and then turn their elbow up about 30, 45 degrees or so, and then go in. So that allows the fingers to go in right up against that muscle there. If they go straight in and across, that's going to get these levator ani muscle groups right there. Also beneficial to release, but again, that's another story. So they go in, they find that sit bone, they're kind of on top of that sit bone a little bit, angle up, and then go straight in. When we are trying to release a tight muscle, you're trying to put pressure, medium pressure, for about 60 to 90 seconds. And you, as the person that has that tight muscle, can provide instruction of saying, no, I think you need to move a little bit more up the pubic rim right here, or maybe change the angle just a little bit and you can wiggle around just a smidge and find different muscle fibers of that muscle belly or distal tendon. This is tricky to guide a person on if you haven't felt it before or if the person is really, really new for it. But again, if you're motivated, you can try to figure it out and it can work out really well. My preferred method when it is my own OI that is painful is to do a self-release in sitting. Now, admittedly, this is a little bit harder. It's harder on our own hands. I have hypermobile joints, and so I have that nice little swan's neck deformity where my fingers kind of bend in funky directions. So if I do this for too long on myself or on a patient, my fingers kind of get stuck and they can go numb and it doesn't feel particularly great. So I don't usually do a self-release on myself for 60 to 90 seconds. I do it until I start to feel my hand get irritated. I take it out. I come back in a little bit once my fingers feel better. And I just kind of work on it maybe 20 seconds at a time. So this one, what you do is you do a goofy salute. So you kind of hold your fingers in what we call this lumbrical grip where they're at 90 degrees. Okay. So let's say it's the right side here. I'm going to do this goofy salute. I'm going to feel for my sit bone. So I'm kind of tipping over to the side and I'm going to curl my fingers up and in this space. Then I can change the amount of pressure by shifting the weight back towards that same side. Okay. Here you can kind of get a feel for maybe you need to curl your fingers in a little bit more. Maybe you need to come forward just a little bit along that pubic rim rather than back behind the sit bone. It's a feel thing. You might not get it right off the bat, and that's okay. I don't expect you to, especially if you're not a physical therapist or a pelvic floor physical therapist. But give this a try and see if that helps to kind of get that muscle to calm down a little bit. Like I said, for me, it works about 90% of the time. More often than not, I'm doing this sitting in a golf cart because we've got a lot of one-way rotation power going on, and inevitably that muscle will start to kind of grip on me. So I'll just kind of sit on it in the cart, and then I'll, do another swing, and then I'll get in the car and I'll do it again. Drives my husband nuts, but it works. Every once in a while, I can't quite get that full release, in which case I'm asking for help or using a pelvic wand. So if you're having a hard time with your hands and you want to give yourself a little bit more leverage, using a tool can definitely be beneficial. You can certainly do a release like this with a pelvic wand. since I'm a physical therapist, I have a reflex hammer. So sometimes I'll use that because it's got like a little bit of thickness to it, but still some firmness. You can use tools, and that absolutely is okay, especially if it protects your hands. If you do have hypermobile joints in your fingers like I do, and you have those supportive splint rings that are really pretty, then you can use those as well. It's not an ideal situation. The ideal situation is you know what it is, it's diagnosed appropriately, you have a pelvic floor therapist doing that internal release, getting finger right on that muscle belly and getting it to release. But that's just not always feasible. So this is that second best, get what you need to get. Hopefully it calms down a little bit. Now, if you also have hypermobile joints like Ehlers-Danlos syndrome or hypermobility spectrum disorder, keep in mind that with any muscle that we have that is spasmodic or tight, if we release that muscle, we also want to strengthen that muscle once we release it. You can release muscles all day long, but it's just going to keep our bodies loosey-goosey unless we start to find that stability. So working on things like the clamshell exercise, doing some bridges. I love doing bridges with a block or a pillow in between the knees so that you can get those hip external rotators to calm down just a little bit and get a little bit more glute strength. Again, these exercises are a whole other bear and something that I'm working on with my Strong and Bendy course. But just keep in mind that if you are doing a release at home, try to strengthen a little bit or activate that muscle after that release. That can be really beneficial. Otherwise, that muscle is just going to keep gripping on you, and then you're going to be doing release after release after release. Okay? So give this a try at home. See if it helps. If it doesn't help, obviously I'm pretty biased towards, seek out a pelvic floor therapist and say, hey, I'm having this weird, funky pelvic pain. It might not be the OI. It can be. It's a problem child for a lot of people. But it might also be some other pelvic floor muscles that are referring into that hip joint space, or maybe we're having some hip impingement issues. There's a lot of factors at play when it comes to the pelvis and hip joint pain. So see a physical therapist if this release doesn't work and you're having continued issues. Otherwise, reach out with questions. Stay strong and bendy.